is Elizabeth Atieno Onyango. I am from Mombasa, Kenya, and I work with GNP Plus, supporting with pediatrics and prevention advocacy. I am joined today here with two amazing individuals, and I'm going to invite you to introduce yourselves. And I will start with Ferry. You tell me your names, where you're from, the name of your organization, and maybe just what you do.
Okay, thank you, Elizabeth. So, hello everyone. My name is Ferry Norila. I am currently working with Indonesia AIDS Coalition, obviously in Indonesia. So, currently we are working on a pediatric program. We have two pediatric programs. The first one is the Bring Kids to Care program, which we have the name Champion ID. Don't ask me what it stands for, okay? It's too long, I cannot remember. Then the second one is the Child Life. So the champion is the service delivery, and the Child Life is advocacy work. So that's our work.
Thank you so much, Ferry. Can you please introduce yourself, tell us what you do and where you're from?
Thank you. So hi everyone. My name is Noguthula Heath, and I am from South Africa, and I'm working for the organizations called Zoe Life based in Durban, and also one of my portfolio as well. I am also serving as a National Secretary General under the children's sector, supported by SANEC and representing civil society. So really my passion is working with children, where we are implementing the Kids Alive program, also working with youth under Youth Thrive.
Thank you so much. Thank you so much for agreeing to join me today for this very important conversation. And it so happened that we are seated here in the city of Kigali in Rwanda. And this is where one of the biggest AIDS conferences is happening. We are all aware that the scientific HIV conference is taking place right now here in Kigali, and there is a lot of conversations going on. There's conversations on prevention, there's conversation on treatment, but again, there is not so much going on around children, around pediatrics, around treatment and prevention for children. And also right now, we are in an era where everyone is talking about ending AIDS by 2030. So when it comes to ending AIDS by 2030 and the work that we do on pediatrics, do you think we are actually on the right path towards ending AIDS in children by 2030, ensuring that no child dies of HIV by then? Are we on the right path?
Wow, so I mean, that's a very interesting that you are actually asking. I think one of the things that I will, before I actually answer your question, is to say we've actually gone far to be able to come into a realization that at some point we do need to have a document that actually needs to guide us what are the things that we need to do to end HIV and AIDS in children by 2030. Then the question you're asking, are we in the right track? I would say we are on the map, we are on the road.
Yeah.
But if we want to end AIDS in children by 2030, I don't think we're doing enough.
It's still too far.
It's still too far.
Yes, I agree.
Yeah. So, I mean, you can add Ferry on that.
We can say that it's still too far. We are on the track, but we are still too far. If you are asking if it's on the track, yes, but it's still too far if we are talking about 2030. Because if we're talking about the most primary thing in pediatric ARV, we're talking about ARV. I'm talking about Indonesia, in my country. So the availability of the ARV in Indonesia is still scarce. And not to mention that the ARV is still funded by international donor. I'm going to say it from the Global Fund. It's 100% funded by the Global Fund. So we need to engage with the government to take the role, the lead to fund this the most important component of pediatric ARV.
Yeah.
I think it's actually very important that you mentioned in the context of Indonesia, and we don't get to see a lot of conversations around what is happening in terms of ending AIDS in children in your region. So like I'm so happy that you are getting to share around the scarcity in accessing ARV, and like we know that it's a life-saving treatment.
Yes.
It needs to be accessible, it needs to be available, and it also needs to be affordable, I would
Yes,
say.
yes, yes.
So like when you say that there is scarcity or a lack of access, is it in general or is it just for children? And then what are some of the challenges that you face in your own implementation working with children? What are the challenges that you constantly come across when it comes to linking children to care and retention to care?
Okay.
Maybe you can
Yeah,
share
yeah.
with us from the context of Indonesia.
Yeah. ARV in Indonesia, we are very fortunate that ARV for adults are being funded 100% from the state budget. 100%. But the thing is, the ARV for children is still funded by the Global Fund. We found that the problem is the government cannot procure an, a number of ARV because it's very small in amount. For example, the number of children living with HIV in Indonesia, this is not a correct number. For example, the number of children living with HIV in Indonesia is 100. But the government can only procure ARV for 1,000. So they cannot procure for 100 because the regulation said that you can only procure 1,000. That's why. So it's still, I don't know. I think because this is a life we're talking about, this is life of a person, right? Even if it's one person, it is life. It still counts. So what we are going to do is to encourage encourage the government to have a relaxation on the regulation on only for example for the children ARV for the children, so they can procure this amount of number without I'm just going to say without getting on wrong on the regulation, something like that. I forgot the word for English, something like that. Yeah.
Thank you, Ferry. Nokutula, if I may come back to you. I think like with children, there's a lot of challenges, right? Because like we cannot access a child as an individual directly.
Yes.
The way as adults can easily like access services on our own, or even like just track me as an adult. For children, there's always like someone in the middle, either a parent or
Caregivers.
and like we know that like you mentioned that you work with children like across populations, like different populations and different typologies. So I just needed to ask also like in your day-to-day work of making sure that children are actually getting access to life-saving treatment and HIV prevention services. I just wanted also for you to mention like a few things about the challenges that you face while you're doing this work, and then some of the mitigation that we can also learn from each other. I'm from East Africa, Kenya. You're from Indonesia. You're from the Southern Africa. So like what are some of your best practices and also some of the challenges that you face during like when you do this work?
Yeah, no, absolutely. I mean, I think, Ferry, you were just talking about the issues of accessibility when it comes to treatment. And you also find out, I mean, in my country, you know, there's access into treatment, but we also have other challenges, you know. When you're talking about children, they don't take themselves into the facility.
Yes.
So that means then in order to be able to reach a child, you need to work with a caregiver. So some of the challenges that you find is that, you know, the child might be on treatment, you know, once they're on treatment, there's issues around disclosure. And disclosure is not an easy subject, especially when the caregiver, they are also HIV positive. So that means before they can actually disclose the child's status into the child, they actually have to deal with their own status.
Yes.
So those are some of the challenges that we experience. And also, let's not shy over stigma.
Yes.
You know, we still have issues of stigma, and we know when there's stigma, there's issues of adherence, there's issues of actually going into the clinic or into a community setting to be able to access services. So, yes, we talked as well about treatment, but there's also the psychosocial support
Yes.
that is required. And then before you even get into the issues of retention, I mean, before you get into the issues of HIV prevention. So really, we need to look after our children that are already on treatment and make sure that you know, they receive all the comprehensive services so that they're able to adhere into treatment. And I think one of the things also we were chatting with Ferry is to how can we make sure that the services that we are providing are child friendly? What tools are we using? How are we communicating with children?
Yeah, yeah.
You know, so yeah.
Nokutula, when you're saying that making sure that services are comprehensive and child friendly, like what do you mean? What are child friendly services and what are comprehensive services?
Yeah. So, I mean, some of the examples that I can give when you are communicating with the child and the caregiver, what sort of language are we using? Are we
Yeah.
using a child-friendly language? Are we simplifying the complex terminologies in a way that a child can understand? For example, if they've got HIV, and you know, are we saying, you know, do you have a jam that you need to take medication so that you can put it to sleep? So of course you have to look at the child developmental stages. You have to also look at the maturity of the child. So yeah, those are some of the examples. And also talking about our healthcare workers. Are we saying, are we providing training for our healthcare workers? Are we providing mentorship so that when they engage with the caregivers, when they engage with children, they are also confident to be able to, you know, discuss the issues around HIV. So maybe, I don't know, so, I mean, we were just chatting as well, some of the, I mean, I know Ferry as well, they've got a beautiful storyline. That they're using in Indonesia.
Yeah.
I don't know. Yeah.
Yeah, we've learned a lot from Joy Life. We went visit them 2 months ago. It was 2 months ago. We learned a lot about how to treat these children, because actually we don't have this kind of let's say program or approach to children. We don't have this children friendly services. Even have children friendly organization. I mean, in our organization we don't have that kind of thing. I mean, if there are children living with HIV visiting our office, we don't have that kind of setups, you know.
For children.
Yeah, for children. But I saw what they are doing. They have this kind of setup. And yeah, when we talk about children living with HIV, we are always dealing with the third person, the second person, the third person. We cannot give information to a 1-year-old baby, right? We cannot give them that.
Yes.
At least we can give them information about germs or everything, started from like 4 years or 5 years. Yeah, 5 years, something around that. But yeah, there's always the middleman. Yeah, the caregivers, their parents. So we need to give them information about HIV. We're talking about children. We need to give capacity to a lot of people surrounding them, even to their, let's say, neighborhood.
Yes.
Schools,
Yeah.
they do that. They did that. Schools, they give information about HIV in schools, so that when they found children living with HIV, they not be stigmatized. In our country, there are still cases children living with HIV being what do you call it? Kicked out. Kicked out from the school, something like that. So we still have a lot of the cases. So yeah, it's very sad.
Yeah, I think the conversations around children are very complex, especially from that age where like a child living with HIV is still in school or is joining school. I have like my own personal story, like where I have joined school, and then the person who raised me now, my caregiver, sees the need to go and disclose to the head teacher that this is a child living with HIV.
Yes.
And it was a few years back, and this head teacher saw the need to actually like I think it's just because of the lack of information
Yeah.
around
Yeah.
prevention,
Yeah.
treatment. So literally, I went back home with a letter saying like this should be the last month.
This is literally you.
Yes.
This is your story.
Wow.
Wow.
So
Okay.
like this is the last month that this child should come back to this school, you know, like just because my caregiver chose to disclose. But I also think it also came from a place where now the caregiver did not have the information.
Yes. Yes. Yes.
Remember, this is a child that you are now taking in because at that age I was orphaned. So you are now taking in this child.
Yeah.
And you are raising the child. So she also did not know how to go about it. And I think it just shows how far we have come as a community of people living with HIV. Because right now, such cases are close to zero. We don't, there are not so many stories of young children being chased out of school because of their HIV status, and it is because of the work that communities have been doing.
Yes.
And I think it was really interesting to see during the opening ceremony of the IAS conference yesterday. I got to see like a presentation that someone was doing, and she was just showing how it was during the first few days of the epidemic, and then how it is right now after science and all these innovations.
And it's improving.
It
And
is.
yeah,
Okay, it's improving. Okay.
yes, and the message was we will not go back.
Yeah.
You see,
Yeah,
like,
yeah.
when like back then during those times, we were seeing that children were dying,
Yeah.
parents were dying, leaving their children.
Yeah.
Yes. Yes.
But again, right now we see improved regimens for children.
Of course.
Yeah.
Yeah.
And
Of course.
which is again taking away now the issue of pill burden. Someone was even sharing with me now the availability of now the treatment that you can dissolve in water and it tastes, it's flavored,
Yeah.
it tastes better. And all these are strategies that we are making to ensure that no child dies of HIV.
Yes.
Those who are already living with HIV are on treatment.
Yeah.
And I think it's very important that we are having this conversation. Like, are we on the right path? We are on track, yes, but are we on the right path towards ending AIDS in children by 2030? We've talked about what you guys do individually in your organizations, but we also know that we are also working with different partners, different stakeholders, different allies. And right now, like again, the conversations on children is really, really not centered, not prioritized.
Yeah.
Conversations are on other things, prevention, new technologies, and all these other amazing scientific development, but we are not seeing quite like strong voices advocating for children. And I'm so grateful for people like you, Noctula and Ferry, that you're so passionate, right, in talking about children's issues. And I just wanted to have a chat maybe, or just have you guys share with us, like, we've had these partners for the longest times. We have implemented different programs with them in terms of like identifying children and putting them on care, having them retained on treatment, you know. So like we have already said, like, you've given me your take on whether we are on the right path towards ending children. And I would just like for you to like give like one or two call to actions. What before the call to action, just maybe tell me or just talk to us about what do you think we should do different with our children.
Yeah. I mean, it's a very interesting question that you're asking. You know, I really think that we've come far, and I think we are not too far as well to, you know what I'm saying, like to get where we want to be.
Yes.
Like you're saying, we are already on a path.
Yeah.
And we have so many stakeholders. We have, people who are specializes on the clinical side of things. We've got partners that are strong on psychosocial. We've got partners that are strong on advocacy. So I really think that all the pathways now, it's time that we put all these pathways together. And then we really put them on a roadmap, and that we really have to be strong. strong collaborations, because if we are strong and we are collaborating as partners, then we can amplify the children's voices.
Yes.
Because we are the voices for the children. So we need to make sure whatever we are doing, there is a representation of the children. You know, and then of course we also want children, with all with the new innovations, we want them to see the future, so that when they also rise, they are able to they're able to advocate for other children. So yeah, I think for me the mark of action will be less focus. We know what is required. We've been working on this for a long time. We need to stay focused on a path.
Thank you, Nox.
Yeah.
Thank you.
That is a
you,
great word. Thank you.
Yes. Ferry, what do we need to do different, and what is your call to action now?
Okay. So I will talk about my country. So I must admit that in my country, I have to admit that we're still working in silos. So if we talk about HIV, the first thing that we are going to approach is Ministry of Health. If we talk about children, there's a lot of stakeholders that we need to be engaged with. Ministry of Education, that's the most important, because we need to give information of HIV to schools, right? While in Indonesia is majority in Indonesia is Muslim. We are not Islamic country, but more than 80% of our citizens is Muslim. So HIV is still considered to be a sin. They will say still, even if it's children living with HIV, it's a sin. It's a product of sin. So when we approach Ministry of Education, they will always say that it is impossible to give SRHR to schools, because they will be giving information about sex, condoms, and everything. So HIV is still always coming from female sex workers and etc. So it's a bit tricky, and we talk about HIV to different stakeholders other than Ministry of Health. So our call for action is, this is no longer a health issue. HIV, it's a multisectoral issue. So we need government, come on, we need to work together. We need to have this 2030 dream came true. So we need to work together. All of us, all of multi-ministerial in government. So yeah.
Absolutely.
Well, thank you so much, guys, for joining me
Thank
today.
you,
for this
Elizabeth.
Yeah, thank you. That was really thought provoking, and thank you also for the work that you do for the community. Like,
Thank you.
yeah,
Working.
communities have been there since the beginning of this epidemic.
Yes.
Yeah, true.
Communities are still going to be there.
Yeah.
So thank you so much, and let's
Thank
walk
you.
the journey together towards ending AIDS in children by 2030. No child deserves to die.
Of course.
Yeah.
No, absolutely.
Especially right now in the era of science.
Yes.
And
Thank you.
new technology.
Thank you for having
PLHIV
us.
Leaders Now.
Thank you. Thank you.